Well, thank you for joining us today for this special webinar for Prostate Cancer Foundation of Australia. My name is Katie Clift. Very pleased to be hosting and moderating today a very important session focused on emerging targeted therapies and the international ProstACT Global clinical trial. For men living with advanced prostate cancer, understanding what new treatments are being developed and how clinical trials work can feel very overwhelming. So today we're planning to break that down in a very clear and practical way. And I'm very pleased that we're joined by Dr. Veronica Wong, representing nuclear medicine at Nepean Hospital and an investigator in the ProstACT Global study, who will help us understand what this research involves and what it means for patients across Australia and New Zealand. Thank you for being with us today, Dr. Wong. It's great to have you. Let's dive right into the questions. And I want to start with the basics. If our listeners, viewers haven't heard of the ProstACT Global study, tell us about what it is and who it's designed for.
So the ProstACT Global study is a really exciting multinational, so international study, which is enrolling men with prostate cancer at an earlier stage after they've had progression of their illness. So it's for men who've had hormone therapy or one course of chemotherapy, and introducing lutetium PSMA, which is not a new therapy, but a therapy which we are certainly seeing and hearing much more of, which could effectively slow the progression of that cancer or even kill the cancer in its stead and hold it at its pace. So the ProstACT Global study is running currently in Australia, but it's also running in other places like New Zealand and Canada and America. And in essence, it's a trial which enables men who may not be eligible locally or may not be able to access treatment with lutetium PSMA, the opportunity to have this treatment, which is a newer treatment, but certainly one that we think is going to make enormous change in the way we treat prostate cancer.
And there may be some confusion about the term. So we often hear that term PSMA-targeted therapy. Can you explain for us in simple terms what PSMA is and why it's important in prostate cancer?
So PSMA, when it was first given that name, stood for prostate-specific membrane antigen. So it was clearly something that was present in high volume in prostate cancer. Over time, we have seen that it's sometimes present in other cancers and in other sort of normal healthy tissues. But by seeing that prostate cancer cells express this as a way of communicating to other cancer cells, and by being able to use this prostate-specific membrane antigen to actually grow and proliferate, we can actually harness that and use what we call lutetium, which is a treatment that actually kills cells, to bind them together. So it's lutetium, which can kill cells bound to this prostate-specific membrane antigen. And so it's almost like a homing pigeon. The PSMA takes us to where the prostate cancer cells are, and then we hit it with the lutetium therapy. So that internalized radiation therapy, it's not your typical radiation therapy, it's injected radiation therapy, but the treatment, in essence, should go to where the prostate cancer cells are hiding.
It's a very clear way to explain it. The study is also investigating a treatment called TLX 591. Tell us about this. What is TLX 591? How does it work?
So TLX 591 is a compound that has been developed by a company called Telix Pharmaceuticals, and TLX 591 differs from other compounds or other formulations of the lutetium PSMA by binding that radiation and that radionuclide to something that's a little bit different called rosipotamab, which is actually a monoclonal antibody. So there are different vehicles in the way that we can deliver the lutetium PSMA. It is still linked to PSMA, but it's linked to a slightly different carrier molecule, the rosipotamab, and that means that it might have a slightly different way that the body handles it, different way that it leaves the body, and that those differences are being studied in this clinical trial according to its effectiveness and also its safety. But we think it's a very useful and also a very convenient alternative to what's currently available, which is usually a 6-week course of treatment. This TLX 591 is actually very simple, very easy to administer. It's a 2-treatment course, meaning that patients have completed the treatment after 2 treatments, and those treatments are given a fortnight apart. So that's what differentiates this treatment. It is still under study, but we think it holds great promise because, in essence, we're looking at a similar effect on the prostate cancer cells.
Yes, that's interesting. You touched on the differentiation. Are there other elements that make TLX 591 different from existing treatments that are currently available for men with advanced prostate cancer?
Yeah, certainly. So TLX 591 is a radionuclide. It's a radiopharmaceutical and has demonstrated in the clinical trials to be better tolerated than other things like chemotherapy. It's not likely to be as toxic to organs like the salivary glands. So often, men who've had other lutetium PSMA treatments will eventually develop some dysfunction of their salivary gland, whether that means that they've got a dry mouth or an altered taste. So potentially fewer of those effects. And when we compare it to things like chemotherapy, there's a much less effect on the bone marrow cells. So when people undergo chemotherapy, we know that they develop side effects like anemias, low blood counts, tendency to get more infections. There's an observation that the TLX 591 and other lutetium PSMA compounds produced less of those side effects. They will certainly be watching for things like a drop in platelets, which can certainly be seen in this treatment. But when we talk about things like tolerability, that is a distinguishing feature of this lutetium PSMA, which is that it's better tolerated. The expectation is that it's not as toxic potentially as the chemotherapy.
Which is a really important point to make and a very important differentiator. We sometimes hear radiopharmaceutical therapy described as you said, like a guided or targeted form of radiation. Maybe let's expand on that a little bit. What does that mean in practice?
So it's useful, I guess, to compare it to other ways that we treat cancer cells. So cancer cells have harnessed an ability to escape the body's surveillance, escape the body's ability to disarm and to disintegrate those cancer cells. So cancer cells have evaded the human body's defenses. How chemotherapy works is it stops cancer cells from being able to proliferate using, elements that healthy cells also use, things like, gaining nutrition or being able to multiply or being able to, reproduce their DNA. When we talk about radiopharmaceutical therapy, we're really talking about a signal, and that signal could be PSMA, it could be any other sort of signal that we can identify in a lab, and we find ways of attaching. So, like a train and a carriage, we're attaching a missile or a treatment to that signal that the cancer is expressing, and so we try and deliver that treatment directly to where that signal is coming from. It's not rocket science. I think it's nice to see that we can actually take pictures of where those radiopharmaceuticals are going, and then we can say, well, that's exactly where the lutetium or the radiation therapy is going to be delivered. So yes, there will be cancer cells that we're targeting, and we can actually visualize them using our PET and SPECT cameras to see the effect. So it's the concept of see what you treat, and that's what underpins this idea of radiopharmaceutical therapy. We can certainly see what we treat, and those pictures are very clear, very crisp, and it's a lovely thing to see when patients are responding well to therapies, and you can see those cancer cells just shrinking in size.
Yeah, I bet so rewarding. And also, it's such amazing technology that you're talking us through. That's incredible. Let's talk about eligibility. Who may be eligible to participate in the ProstACT Global trial, and tell us about what stage of disease it's focused on.
Men with prostate adenocarcinoma, so the most common form of prostate cancer, are eligible. They need to meet certain criteria where they're going to be relatively healthy and well. So they have to be able to care for themselves and be out of bed more than half the day, and be able to do day-to-day activities. When we test them, they have to have good kidney function, they have to have good heart function, and have to have normal kind of blood counts. So that includes things like the platelets and the white cell counts. And on top of that, these men are progressing, meaning that they're showing signs that the cancer is being able to evade or escape those treatments that they've had before, and those treatments would be either a single course of hormone therapy, so treatments like abiraterone or enzalutamide, or a single course of docetaxel chemotherapy, which is a chemotherapy that's often given when men come to present with prostate cancer and it's already spread from outside the prostate. So this is specifically for men who've already had prostate cancer treated, where that prostate cancer has spread outside of the prostate into another tissue, like a lymph node or a bone cell.
And give us some more details for those that may not have participated in a clinical trial before or may not be familiar. What participation in this trial would involve for patients? So in terms of screening, treatment visits, follow-up, what does that look like?
So clinical trials are quite a big, I guess, time investment, and also a consideration that you'd be giving up your time, your imaging, and your blood tests so that we can actually see how well the treatment works. So when patients are thinking about being a part of a clinical trial, they'll undergo a period of screening, which could take several weeks, and that is really just to make sure that they meet a very rigid set of criteria to say that they are considered the best match the population that we're trying to treat. And that means that we can actually say, answering a particular question in a group of men with these characteristics, would this treatment work? The treatment visits will encompass, slightly more than what your normal day-to-day kind of treatment with cancer would include. It might include extra blood tests, extra physical sort of tests, as well as things like ECGs and blood tests. So, treatment visits in this particular trial might include a weekly visit to the clinic for the first 2 months. And then after that, the follow-up is spaced out, so it becomes more closer to every 2 to 3 months. And during those visits, those checkups to make sure that you haven't had a bad reaction to the treatment, but also to follow how well that treatment is working. So it's quite intensive, but worthwhile when these treatments are actually not available, but only through a clinical trial, are accessible to people that otherwise may not have opportunity to ask for this kind of treatment.
Absolutely, absolutely. And you're currently recruiting, so you've got 12 sites across Australia and New Zealand. Give us an update on recruitment and what it might mean for men who are considering enrollment in the trial.
So this is really exciting, and I am, Telix Pharmaceuticals is an Australian company, and so we've got the opportunity really as Australia and New Zealand to offer this treatment, above or ahead of, the rest of the world. And so we are one of 12 sites across, Australia and New Zealand. And currently we're finished what's called part 1, which was a slightly more intensive part of the trial where men were recruited and had to do more tests to see how well that treatment was being absorbed. And so in the part 2 of the trial, we've currently reached about 30 men being screened, and about 10 of them have already been treated with this treatment. So we're aiming to get closer to 500 men across multiple, international sites. It is early days yet, but certainly I think the results are somewhat exciting, and something that we, are likely to hear more of as time goes on.
And I found this really interesting about the trial itself. So ProstACT Global is now a phase 3 study. Take us through what that means and when we may see the results of it translate into regulatory approval. I know you said early days, but what does this sort of timeline and trajectory look like?
So when we're in phase 3, it is a extremely super exciting time. It means that the trial has been able to show that it's relatively safe in, a smaller cohort of men, but it'll be in the order of hundreds of men across different multinational sites. And so when it's phase 3, that means that we're looking at proving that it really is better than what's currently being offered. And that's really the game changer. If we can show that such a simple treatment, which is, 2 treatments 2 weeks apart, can actually improve the outlook of someone who's, got limited options, then, it almost means that treatment is very likely to have support through regulatory authorities. And in Australia, that's the TGA, and then through, government funding organisations, to actually see that it's a treatment that the government supports that will co-pay pay or fund for that treatment for a particular group of men and actually use it as part of normal care. So it's in that process of proving that it's effective before it becomes approved as a official and recommended treatment. These are required steps, but these are the sort of steps that we require that sort of early evidence, those support that it's safe and effective in men. And I think it's important that we look at these trials as an opportunity to actually see what treatments are available, but also have the ability to say, well, this treatment is available to you and it could make a difference when there are limited options available.
Absolutely. And we've talked about men who are eligible or may be eligible. For men who may not be eligible, what would your advice be regarding what they should discuss with their treating team about emerging therapies and future trials?
So the prostate cancer field is evolving, and I think it's very exciting because, we inherently think that this is a cancer that many men live with. We still believe that. And it could mean that it's an illness that, lasts for maybe 10, 15 years. And when men are starting to experience change, and that means their oncologist is telling them that, things are going in the wrong direction, or that PSA or the prostate-specific antigen is rising, I think that's an important time to actually have all the treatment options laid out and, kind of go through the pros and cons. I mean, I'm a strong advocate for patients being given that information and being able to make their own decisions. And sometimes, your previous experience being on hormone therapy and chemotherapy will guide, whether or not you'd be willing to try something that's a little bit not as commonly used, but is certainly showing promise. So I think it's important to consider this treatment not as an experimental treatment, but actually as a treatment that is very likely to become adopted as one of the common and more likely treatment that would play a role in a similar vein to chemotherapy and hormone therapy. Clinical trials are always out there, and I don't think we should be holding back. What I mean by that is it's only a matter of asking the question and looking for what resources are out there, and it could mean doing an internet search or looking for a trials network that actually has a list of clinical trials that men might be eligible for, and actually asking those questions as much as you can. So as a patient, I think it's important that patients are given that empowerment and advocacy so that they can actually have a choice.
And are there specific places that patients and their families should go for that reliable information? I know that there's a lot out there and you can get lost in this world of understanding clinical trials and what's coming up, and it can be overwhelming for some men. So where can they go for that reliable info?
So there are wonderful networks such as the Prostate Cancer Foundation of Australia. And I have to say, men with prostate cancer, I think you could turn around the corner and you'd meet, someone who's had experience or knows of someone who's had experience. So, it's about getting that conversation started. Your GP is an initial starting point, and it's places that we would say has reputable following or has a reputable association, and it'll be things like Cancer Council of New South Wales, Cancer Council of Australia. It'll be there are some patient-directed clinical trial kind of listings that you could look for, specific things that are, about your own situation, whether it's prostate cancer and how what stage it is. But certainly there are clinical trial registries which your oncologist would be able to direct you the best in.
This has been a fascinating conversation about the trial itself, and I think you've given us really a bird's eye view too in terms of understanding the landscape, right, of emerging technologies and where we're headed, where we've come from with prostate cancer treatment. It's been great to have you on this session. Is there anything you feel like we haven't touched on or you'd like viewers and listeners to leave the conversation with today?
Thanks very much, Katie. Look, it's been a wonderful opportunity to talk about something that's really quite exciting and I think dear to my heart, because I think lutetium, PSMA, and other radionuclides are really emerging as, the next big thing in cancer treatments. And I know it's a little bit different. You might be sent to a different center or a different doctor who might try to explain to you what this treatment involves. But as much as I can, I cannot stress enough the importance of empowerment, you knowing your own illness and what stage you're in, and making decisions that help guide yourself, but also, guide men that might be following your footsteps. So I think that men with prostate cancer are living with this disease for much longer, and it's important that we develop these treatments more and more so.
Absolutely. Dr. Veronica Wong, it's been an absolute pleasure to have you on the webinar today. Thank you so much for your time.
Thank you very much. Thank you, Katie.
Again, another important webinar from Prostate Cancer Foundation of Australia. And we thank you again, Dr. Veronica Wong, for sharing your expertise, helping us better understand the ProstACT global study and the evolving landscape we've talked through today of targeted prostate cancer treatments. As always, if you need support services for prostate cancer, you can always get in touch with the Prostate Cancer Foundation of Australia via calling us, our telenursing service, 1-800-220099, or you can visit our website at prostate.org.au. Thank you for tuning in today, and we look forward to seeing you next time.